In our day-to-day lives, we do a lot with our hands. Repetitive motions like typing and texting can lead to carpal tunnel syndrome.
And what happens over time is from various reasons that tunnel gets narrow, that median nerve then gets compressed, and that's ultimately what gives people carpal tunnel syndrome, the numbness, the tingling, the pain, the weakness.
Holly Shadle is a certified registered nurse practitioner with UPMC, seeing patients at the Neurological Institute in Williamsport. Shadle says patients can manage symptoms with braces, medications, and stretching, but some patients need a procedure to release the nerve. At UPMC, most patients have a minimally invasive option guided by an ultrasound machine in the office.
Basically just numb it with some numbing medication, almost like Novocaine when you go to the dentist. We then, through a tiny little hole in your wrist, we use a little handheld device. We go up to where that kind of ligament's across, we release it, pull that device back out, and we're done. It's a 5-minute in-office procedure.
Recovery time is much shorter compared to the traditional surgical option.
Because it's so minimally invasive, we usually just have you take it easy for a couple of days. Usually 3 days, no major movement with the wrist. You can use your hand, you can use your fingers. We just don't want you doing a lot of bending, lifting, twisting with the wrist. Usually after about that 3-day period, you can start getting back to all of your normal activities.
Shadle says patients can get a referral from their primary care doctor to determine treatment options in an effort to avoid long-term damage.
When it really goes untreated for a long time, you can start to get atrophy of the muscles. And oftentimes when it gets that bad, you can kind of have sometimes permanent nerve damage and permanent muscle damage and kind of loss of function in the hands.
In this Healthwatch 16 report, Emily Kress, Newswatch 16.